Hi, I'm Asim Belgaumi. I'm a pediatric oncologist from Pakistan, and I want to talk to you today about leukemia in children. Leukemia is a cancer of the blood. In fact, it's actually the cancer of the bone marrow, because that's where blood is formed. So the bone marrow is the factory for blood, and a defect in the production results in the leukemia. Leukemia, the word itself really comes from Latin for white blood. And this is because in the vast majority of patients, leukemia presents as a high white blood cell count, resulting in a somewhat lighter color of the blood for the patients. Now, leukemia in children is divided into two types. There's acute myeloid leukemia, or AML, which occurs in about 20% of all children with leukemia, and acute lymphoblastic leukemia, or ALL, that occurs in the rest, 80% of children with leukemia. Treatment is available for both acute lymphoblastic leukemia and acute myeloid leukemia. The treatment for AML is much more intensive, and in some cases may require bone marrow transplant as well. And the outcome for children with acute myeloid leukemia is about 60 to 70%. Children with ALL, on the other hand, are treated with less intensive chemotherapy, but this is much more prolonged. Over 2 years, between 2 and 3 years, duration of treatment is required for treatment of acute lymphoblastic leukemia. But the outcome for this in high-income countries is extremely good, with over 80 to 90% of children being cured of their leukemia. In low and middle-income countries, the outcome for acute lymphoblastic leukemia is somewhat less than what is seen in high-income countries. But even here, depending on the center and the country that the child is at, the outcomes are close to the 80% that is seen in high-income countries. Treatment of leukemia requires referral to a center that is capable and has the expertise to treat children with ALL. As parents or as referring physicians, if you feel that a child may have leukemia, then it is best to transfer them early, to refer them early to a center such as this, where acute lymphoblastic leukemia can be treated, so that they get the right diagnosis and the treatment. The diagnosis for ALL, for acute lymphoblastic leukemia, is both based on an examination of the bone marrow. So these children will undergo a bone marrow test, a bone marrow biopsy, on which further testing is done. And then based on their risk, with multiple factors that are taken into account, the patients are categorized into standard risk or intermediate risk or high risk. And treatment is tailored towards that. Regardless, treatment for these children is essential. And I would urge all referring physicians to send those patients that you have that are suspicious for acute lymphoblastic leukemia to centers that can take care of this. Thank you very much.